Hi, I'm Donald Abrams, and I am Chief of Hematology Oncology at San Francisco General Hospital. I also have a consultative integrative oncology practice at the UCSF Osher Center for Integrative Medicine, and I'm a professor of medicine at the University of California, San Francisco. I've been doing research funded by the NIH, or the Center for Medicinal Cannabis Research in the state of California, since 1997. I am a practicing oncologist and see every day patients who benefit from using cannabis, the whole plant, either inhaled or using edible products or extracts. It amazes me. I've been an oncologist now for 32 years, and at the beginning of my training to be an oncologist in the 70s, it was a time when clearly cannabis was more widely used in the community. We had many young patients with cancer, particularly Hodgkin's disease and testicular cancer, that we treat with the same chemotherapy drugs that we use today that cause a lot of nausea. And in those days, in the 70s and early 80s, our patients said, hey, you know, cannabis is much better than the prescription antiemetic drugs that you're giving us to treat the nausea. And in fact, they were correct. Now we do have stronger drugs for treating nausea in patients with chemotherapy-induced nausea and vomiting, but for many of my patients, cannabis works the best. I just hear that all the time. I collect the emails that I get from patients telling me that, you know, it took them a while to fill the recommendation that I gave them because of their own stigma about using cannabis. I have a 42-year-old guy who's a father of young children who said it took him 5 cycles of chemotherapy for his metastatic colon cancer before he finally tried cannabis, and he said it did what no other medicine could do, completely stopped his nausea and vomiting and allowed him to live a normal life and play with his kids. And he was requesting a refill of his, renewal of his cannabis letter because he said he's now cancer-free, largely probably because he was able to tolerate the chemotherapy with the aid of cannabis, and he just wants to use cannabis products for sleep instead of relying on pharmaceuticals. And I'm all in favor of that because this is a plant, a natural product, and it's not a pharmaceutical agent. I also see a lot of patients with end-stage cancer who have been put on very heavy doses of opiates by their physicians, and they come to me and say, you know, I'm dying and I want to be able to be there to communicate with my family and my loved ones, and these drugs knock me out. So invariably I've seen patients wean themselves off of opiates, which are addictive, have many, many intolerable side effects, and just treat their end-of-life symptoms with cannabis. And I think that's a blessing. I ask all of my cancer patients what brings them joy. The number of my patients who say that gardening brings them joy is not insignificant. I think that if you yourself are dying or you feel that part of you has died, the ability to bring life out of the earth is a very special gift. And for patients to be able to grow their own medicine, that's very empowering. Cannabis, as I mentioned, is useful for nausea and vomiting. It's also the only anti-nausea drug that also increases appetite. So many patients with cancer, be it on chemotherapy or not, have decreased appetite and weight loss. And cannabis, in addition to decreasing nausea and vomiting, again, is the only medicine that we have that does that as well as increasing appetite. I mentioned pain. I've done a number of studies in pain. We did a study in patients with HIV-related nerve damage in their hands and feet, peripheral neuropathy. And this was a placebo-controlled study, so half the patients smoked cannabis and the other half smoked cannabis from which the active ingredients, the so-called cannabinoids, have been removed. And in that study, we clearly demonstrated that cannabis was beneficial in this very difficult-to-treat symptom. Many patients are treated with opiates, which again are addictive and have a lot of side effects. Often we use anti-convulsant drugs for this, and many patients are not happy with their side effects either. So cannabis works, and that study was funded by the University of California Center for Medicinal Cannabis Research, who also funded 3 additional studies in patients with painful nerve damage, and all of them found exactly the same thing, that you need to treat 3.5 people, if you will, with cannabis for one of them to benefit. The fact that all of the studies came up with the same consistent finding is really remarkable and demonstrates the potency of cannabis in reducing the effects of this very disturbing symptom. Again, for the government to say that cannabis has no accepted medical use is a little bit disingenuous in face of this mounting evidence. We've also done a very important but small study showing in patients on chronic long-acting opiates, either sustained-release morphine or sustained-release oxycodone, that if they added vaporized cannabis, number one, there was no change in the level of the opioids in their bloodstream. In fact, either it went slightly down for the morphine group, stayed the same for the oxycodone group, but we did see a trend towards increased relief of pain. And again, this is something I hear from patients, that they can get away taking less opiates for longer periods of time if they use cannabis adjunctively, that is, in addition to their opiates. So, a study that still needs to be done, in my opinion, is a study in patients with chemotherapy-related peripheral neuropathy, nerve damage to the hands and feet in patients who receive many of the chemotherapy drugs that we use that create this symptom. There's convincing animal model data that cannabis is useful in not only treating chemotherapy-induced peripheral neuropathy, but also in preventing it. So this is a very ripe area for doing research with this plant. I am one of the co-editors of the National Cancer Institute Physician Data Query Complementary and Alternative Medicine website, NCI PDQ-CAM. And on that website, we summarize all the beneficial effects of cannabis in patients living with and beyond cancer. My personal belief is that cannabis is very effective for symptom management, as I've stated. But there is also some evidence from the test tube and in animal models that cannabis may have some utility actually in fighting cancer itself. I don't think that this evidence that we see in the test tube and in animal models has really translated yet into the human situation. And my personal recommendation to my patients who want to treat their cancer only with cannabis is that, in general, I don't think that's a good idea, especially if they have a curable malignancy. But I do often recommend that patients with cancer undergoing conventional cancer treatment with chemotherapy, radiation, or targeted therapies add a cannabis product. How do patients take cannabis is a question that I'm often asked by my cancer patients. Many of my older cancer patients think that eating is normal and smoking is bad. So they tend to go to the dispensary and get a baked product or something that they take by mouth. The kinetics of the absorption of the active ingredients are very different when cannabis is taken by mouth compared to when it's inhaled. It takes 2.5 hours to reach a peak concentration, which is quite low, and when it goes through the liver, the delta-9 THC, the psychoactive component, is metabolized into another psychoactive component, which makes people, if you will, more zonked when they eat cannabis than when they inhale it. So for managing symptoms, I often recommend vaporization as a good option because the peak concentration of the cannabinoids occurs in 2.5 minutes after inhalation and then rapidly declines with much less of this other psychoactive metabolite form because it doesn't go through the liver. So if patients want to control the onset, the depth, and the duration of effect, I think inhalation, either vaporization or smoking, is probably better than eating baked goods. If people want, or taking tinctures, for example, if people want a more sustained effect for a longer period of time, many of my patients benefit from taking a tincture at night before they go to sleep. Then the question is always, well, should it be THC or should it be CBD, cannabidiol? We know that delta-9 THC is the main psychoactive component of cannabis. CBD is one of probably 100 other cannabinoids that are present in the plant, and that I believe they're there to modulate the effects of THC, so to enhance the beneficial effect and downplay the negative effect. THC binds with the cannabinoid receptor. CBD actually doesn't bind with the receptor. So right now there's this whole movement towards everything should be CBD. And I think that's part of what Clint often calls euphoranoia, that we're phobic, we're fearful of people being happy and high because CBD is not psychoactive. It is a potent analgesic and anti-inflammatory, so it does have some utility, but should cannabis, some states are now only approving CBD and not inhaled, and I think that's very short-sighted. You know, this is a plant. Nature gave us the plant. Let's use it as a medicine. To forbid growing this plant, which is medicine, to me seems quite short-sighted. Ultimately, I believe in California, cannabis will be legalized, and the economic potential of growth of this plant is, I believe, enormous. So I think we should allow people to have their medicine, especially when it's as natural and as harmless, if you will, as cannabis sativa or cannabis indica.